Now from the Target 12 investigators, the healthcare crisis. If you're having trouble getting a primary care doctor, data we reviewed shows you're not alone.
And Rhode Island isn't recruiting enough doctors fast enough to fill the gap. Target 12 investigator Alexandra Leslie spoke to advocates for primary care and a Rhode Islander struggling to find a provider.
Data from Brown University estimates there are nearly 700 primary care professionals in Rhode Island, including nurse practitioners and physician assistants. But experts I've talked to say hundreds more are needed to cover the entire population.
68-year-old David Carlbert has been without a primary care doctor for more than a year.
I'm stuck in the middle of a mud pile.
The Charlestown resident, who has multiple health conditions, including diabetes, reached out to Target 12 in January.
I had one doctor for 3 years, he left. I had another doctor for 1 year, she left.
He says a third doctor moved practices in December 2023. Carlbert says he hasn't been able to get a new doctor and was told the earliest availability is November 2025. Chronic pain in his back and legs also means he relies on rides to appointments.
So this device here is basically your doctor right now.
Yeah. So what I've been doing is I've been testing my blood, and I started monitoring my blood pressure.
Research from Brown University's Warren Alpert Medical School shows there are likely hundreds of thousands of Rhode Islanders that don't have a primary care doctor. Researchers estimate there are 641 primary care providers for Rhode Island's population of about 1.1 million. That's one doctor for more than 1,700 people. Researchers found if every physician saw 1,200 patients a year, roughly 343,000 people would be without a provider. They estimate the state needs nearly 300 additional physicians.
We're not producing enough primary care clinicians.
Former Rhode Island State Health Director Dr. Michael Fine is the president of Primary Care for All Americans. The group's mission is to ensure every American has a family doctor.
But if you're the person with melanoma, then, something that was curable today becomes a devastating illness in a year, 2 years, or 3 years.
Fine says he also worries about people with chronic conditions like diabetes.
If you don't have a primary care doctor, the likelihood of you ending up in the hospital or losing a limb is way greater, or becoming blind, which are the complications of those diseases, is way greater because there's nobody reminding you and checking in on you and making sure you get the kinds of services you need.
For now, Carlbert says he'll rely on walk-in clinics and do the best he can to stay on top of his health.
So I don't plan on getting sick. I just try to take my meds.
So how can Rhode Island grow its primary care provider population? What an expert I spoke to says could help and what the state is doing. That's all coming up new at 6. With the Target 12 investigators, Alexandra Leslie, 12 News.